Good afternoon, and welcome to the 2020 Dean's Community Service Awards Ceremony. I'm George Daly, the Dean of Harvard Medical School. I'm delighted to welcome you all today as we recognize and celebrate the remarkable recipients of this year's Dean's Community Service Awards. Their commitment to service is inspirational. You, our award recipients, are indispensable members of the communities you serve. Your work enables those communities to thrive, and we value your contributions to community service now more than ever. Outside of your many responsibilities, you devote countless hours to helping others. Your commitment to your respective communities also advances the mission of Harvard Medical School, which includes not only research and education, but also service. We are deeply grateful for your dedication. The Dean's Community Service Award was established in 1999 to honor individuals at the medical and dental schools who've made outstanding contributions to local, national, or international communities. Now, I'm particularly proud of this award program. In a real sense, it pays tribute to our entire medical community, a family of faculty, trainees, administrators, staff, and students. The program highlights our community's deep, sustained commitment to service. It also showcases the exceptional outreach efforts of Harvard Medical School and the Harvard School of Dental Medicine. Now, these efforts extend from Harvard to our near neighbors and beyond, to the underserved, the needy, the suffering, and the forgotten throughout the world. Over the past 21 years, we've presented the Dean's Community Service Award to 164 awardees serving 152 organizations. And to honor each of our Community Service Award recipients, Harvard Medical School contributes $1,000 to the organization for each recipient, the one that they work so hard to support. You, our 2020 honorees, together with the organizations you serve, have made tremendous contributions to diverse populations. For example, you have founded organizations that serve communities with severe education funding shortages, connect communities to healthcare, and help to end hepatitis B in the Philippines. Help middle school girls find passion in science, technology, engineering, and math, also helping to address gender disparities. You bring life-saving medical care to patients with kidney disease in Haiti, provide forensic medical psychological evaluation to asylum seekers, improve the lives of patients with Alzheimer's by pairing them with college students for one-to-one visits. Your impressive and life-changing efforts are evident in the many nominations submitted to us this year. One honoree has been volunteering to help empower survivors of sexual violence so that they can heal. Another honoree has dedicated his vacation time every year for the last 10 years to volunteering at a free summer camp for children with cancer. And yet another honoree has transformed a local farm to a place that promotes access and appreciation for local agriculture. Many of this year's recipients exemplify a lifetime of service, and we gather here today to salute you all. We salute you as creative and tireless leaders within the HMS community. We salute you as selfless innovators in advancing our mission of outreach and service. We salute you as activists, ambassadors who are truly beyond compare in campaigning for better health and better lives for many here in Boston and around the world. You have our sincerest gratitude. I personally thank each and every one of you. And it's now my pleasure to turn the podium over to Dr. Joan Reed, the HMS Dean for Diversity and Community Partnership. Joan.
It is indeed my honor to introduce and present the recipients of the 2020 Dean's Community Service Award. And I want to start this by thanking you, Dean Daly, for your support of this effort and your support and encouragement of the service for all throughout our community. This year, we received 72 nominations that were submitted for 56 nominees, and an advisory committee with representatives from Harvard Medical School and School of Dental Medicine and our affiliated hospitals carefully reviewed and discussed each nominee and recommended today's recipients. All of our recipients are here with us today, and I want to send out a hearty congratulations. Next, we're going to show a video in which you'll hear each of the recipients talk about their service, their organization, what this means to them. And at the end of this, we will come back, at the end of the video, we will come back and ask for all of them to show their trophies for a screenshot. And with that, here's the video of our 2020 Dean's Community Service Award recipients. This year, we are pleased to recognize 2 staff members with the Dean's Community Service Award. The first staff recipient for the 2020 Dean's Community Service Award is Jessica Alpert. Ms. Alpert is a case writer and researcher at the Center for Primary Care at Harvard Medical School. She receives this award for her volunteer service at the Boston Area Rape Crisis Center. Congratulations, Ms. Alpert.
The Boston Area Rape Crisis Center, or BARC, was founded in 1973 and is the only comprehensive rape crisis center in the greater Boston area, and is the oldest and largest center of its kind in New England. Their mission is to end sexual violence through both healing and social change. BARC provides free, confidential support and services to survivors of sexual assault ages 12 and up. In 2016, I joined BARC's medical advocacy program as a volunteer. Medical advocates meet survivors at the hospital following a sexual assault 24 hours a day. Once there, advocates provide comfort by sharing knowledge, offering empowering support, helping survivors talk with medical staff, and ensuring that the survivor has next steps and referrals. As a medical advocate, I was on call every Saturday for an overnight shift, and if called, I met with survivors in the emergency room, sometimes for 6 to 7 hours, sometimes for 5 to 10 minutes. Our advocacy and support is really tailored to the needs of that specific survivor and what they need in that moment. Now in the role of a peer supervisor in the program, I am on call for at least 1 weekend or 4 overnight shifts a month. And during that time, I help to run the program, dispatch medical advocates to hospitals, and serve as a support to the other advocates in the program. I would especially like to thank Amanda Drapacho and Sandra Gold for their leadership in the program, and to the other advocates for creating a community that I am so honored to be a part of, bearing witness to the survivors' incredible resilience and courage has been among the most humbling experiences of my life.
The second staff recipient for the 2020 Dean's Community Service Award is Dr. Tara Laureate. Dr. Laureate is the Program Director for Academic Affairs at Harvard Medical School, and she receives this award for her service at the St. Paul Parish Food Pantry. Congratulations, Dr. Laureate.
We work with produce rescue organizations to address food insecurity by giving out produce and bread that would otherwise go to waste. Instead of handing people a bag of generic canned goods that they'll probably never use and may even re-gift to another food pantry, people get to choose a few items each week that they need. With our guiding principle of dignity, there's no paperwork and people don't have to prove that they're poor. I started volunteering at the food pantry in 2013. Since assuming a leadership role the following year, I've worked to establish new partnerships that have allowed us to get special treats from stores like Cardulo's Gourmet Shop and Eataly, and also nonprofit organizations such as Hope and Comfort. I've also made a special effort to periodically distribute non-food items, things like toilet paper, laundry detergent, or toothpaste, which are essential but can't be purchased with SNAP benefits. I would like to thank everyone who has contributed to making the award possible, as well as everybody who supports the food pantry, including volunteers, donors, and staff at the church who provide on-site support when we're not present.
We are pleased to recognize 3 students with the Dean's Community Service Award this year, and it's my pleasure to introduce them. Our first student recipient is Pooja Chandra Shakar. Pooja is a member of the Harvard Medical School class of 2023 and receives this award for her service at the Project CS Girls. Congratulations, Pooja.
Project CS Girls is an international, youth-driven nonprofit dedicated to closing the technology gender gap. We strive to cultivate a love of technology and computer science in middle school girls and support their development into future leaders. I started Project CS Girls because of my personal experience with the tech gender gap. 7 years ago, on my first day of high school, I looked around my computer science class and realized I was one of just 3 girls. To address these glaring disparities, I founded Project CS Girls. Our goal is to show girls that they can use technology to make a difference in their communities. Research shows girls tend to gravitate towards socially minded careers or projects, and we want to show them that technology is a fantastic way to accomplish this. And we focus on the critical middle school period because this is when students are most susceptible to peer pressure and stereotypes, and our goal is to dispel these negative stereotypes. As the founder and CEO, I'm responsible for managing our incredible team of 50 high school and college women. From growing the organization from its local roots to an international one, founding Project CS Girls has been an incredible journey that sparked my passion for gender equality in STEM. Thank you again for this award. It means so much to receive this recognition from HMS, the place I can truly call home. This is for my amazing family, mentors, team members, friends, and most importantly, my students. Thank you for believing in that overly eager and passionate 15-year-old who wanted to help build a better world. And thank you for inspiring me every day since.
Our next student award recipient is Kayla Davis. Kayla is a PhD candidate at the Biomedical Sciences graduate program at Harvard Medical School and receives this award for her work at the Oklahoma Science Project Code Sci Lab. Congratulations, Kayla.
Code Sci Lab started in 2016 in an effort of my own to give back to the community I came from in Oklahoma. Oklahoma education funding was severely suffering, and I set out to come up with a resource that could give back to students who were really excited about studying science in Oklahoma but weren't getting the funding resources that they needed in school to do that. The organization started by recruiting some of my fellow Harvard classmates who were particularly good at programming, and we developed lessons that teach high school age learners how to use programming to solve science problems. Our organization has created a set of lessons that are available for free online for anybody to take. And we also host workshops for both high school students and high school educators that teach them how to use the tools that we've created to learn how to code and to integrate coding into their classroom. I would like to thank the fantastic students at Harvard who have worked on this project with me, who have spent countless hours developing this tool, namely Rebecca Fine, Kate LaChance, Jane Hong, Noah Block, and Emily Kerr, who have really built this up from the ground and made this what this is, and used their love and devotion to teaching STEM education to further our mission.
Our third student award recipient is Renaud Rafi. Renaud just received his MD from Harvard Medical School a few months ago, and congratulations on that. He receives this award for his service at the National Alzheimer's Buddies. Congratulations, Dr. Rafi.
Alzheimer's Buddies is a nonprofit that pairs college students with dementia patients living in nursing homes for weekly one-on-one visits. Alzheimer's Buddies strives to improve the quality of life for dementia patients and foster student development. The organization first started almost 10 years ago at Harvard College as a student group by my colleagues and mentors, and has spread to over 15 college campuses. Over 1,000 students have dedicated thousands of volunteer hours to visiting our buddies, getting to know their family members, and organizing advocacy events like our biannual symposium. Student volunteers often share the meaning and impact of making their buddy smile, while family members share the value of seeing their loved one continue to connect despite their dementia. I first joined as a volunteer back in 2013 and later became a student director of my local Harvard chapter. Within a few years since the founding of the Harvard chapter, students from across the country began reaching out to start their own group. My colleagues and I began organizing and started a national nonprofit to oversee each college chapter. Before entering Harvard Medical School, I served as CEO of National Alzheimer's Buddies, and it was a rewarding experience to see our initially small group grow across the nation. I also still vividly remember the visits I had with my buddy. We enjoyed listening to classical music, participating in competitive bingo games, and conversing with other residents and students. I'm so proud of my colleagues and mentors who made this happen, the incredible volunteers, and I'm grateful for the recognition by HMS. Alzheimer's Buddies will continue to support individuals living with dementia and the growth of our local chapters. Thank you so much for having me here.
It is now my pleasure to introduce the Trainee Awards. Our first Trainee Award recipient is Dr. Iska van der Riest, Research Fellow in the Department of Cell Biology at Harvard Medical School. She receives this award for her service for Go Viral. Congratulations, Dr. van der Riest.
I'm a postdoc in the cell biology department, and I also run a social enterprise, Go Viral. And we connect communities to care to help eradicate hepatitis B in the Philippines. And I know right now coronavirus is on everyone's mind, but the fact that hepatitis B is also a global pandemic is not as well known, but it actually affects 257 million people worldwide, and it causes more deaths than HIV, malaria, or tuberculosis. And I learned all this when I met my co-founder in 2018, and we decided to get our talents together and launch Go Viral. And today we liaise with government, pharmaceutical companies, healthcare providers, and many other stakeholders to help our patient community access testing, monitoring, and treatment. And due to COVID-19, many of our indigent patients have become food insecure. So in line with the community service spirit of this award, we launched the COVID-19 Food Assistance Program. And the first round has just been distributed by our community manager last June, and it really makes a difference for our patients. So thank you so much for supporting us. And I just want to center, highlight, and thank my amazing team in the Philippines, my co-founder, Ryan Hirsafa, our community manager, Ariel, and Angelou and Cern for all their support. And I know we'll find a way to adapt to all these challenges and keep pursuing our mission of a hepatitis-free Philippines. Thank you.
Our next trainee recipient is Dr. David Harrison, a clinical fellow in pediatrics in the Department of Cardiology at the Boston Children's Hospital. He receives this award for his volunteer service at Camp Ronald McDonald for Good Times. Dr. Harrison, congratulations.
My name is Dr. Dave Harrison. I'm a pediatric cardiology fellow at Boston Children's Hospital, and it is my absolute honor to accept the Harvard Medical School Community Service Award on behalf of Camp Ronald McDonald for Good Times. It's a summer camp with outdoor activities for children with cancer and their families. So over the course of the year, we'll serve hundreds and hundreds of kids, and most importantly, everything we do is cost-free. It's more than just a place to go have fun and ride horses and swim, but it's a place that's really oriented towards growth, where we've taught kids who have been isolated from their peers to really build a sense of positivity, self-identity, and being able to see other kids who have gone through the same thing. I got involved just leading up into medical school as a cabin counselor. I just have a cabin full of campers. Since I've grown in my medical training, I've worked on the medical staff as well. But really, in my opinion, nothing beats just being a regular counselor. I would just like to thank the selection committee for their generosity, and then thank everybody at Camp Ronald McDonald, most specifically the families themselves. Thank you for trusting us with your kids. Thank you for sending them back to hang out with us year after year. It is the highlight of all of our time. Thank you.
This year, we are pleased to recognize 4 faculty members with the Dean's Community Service Award. Our first faculty recipient is Dr. Robert Brown. He's an associate professor of medicine at Beth Israel Deaconess Medical Center and receives this award for his service at Torch, the Organization for Renal Care in Haiti. Dr. Brown, congratulations.
After the Haitian earthquake 10 years ago, Dr. Brian Remillard brought a dialysis machine from Dartmouth to Haiti. He saved the life of a 28-year-old woman with kidney shutdown. Brian opened my eyes to what one committed person can do in a low-resource country. So I got the idea to form TORCH, the Organization for Renal Care in Haiti, as a charity dedicated to saving lives by bringing education and kidney care to Haitian patients. A year after the earthquake, Partners in Health opened HUM, a modern hospital in Mirabelle, at which TORCH could help with the education of medical residents and nurses by bringing them to BIDMC and Dartmouth in France. With this program, we have helped train HUM staff to initiate hemodialysis, saving the lives of about 2/3 of the 100 patients with acute kidney failure we have dialyzed thus far. TORCH has provided 2 ultrasound machines so their residents can perform abdominal and cardiac ultrasounds. The HUM team is sending kidney biopsies to be read gratis at BIDMC by Dr. Isaac Stillman. We are helping the HUM chief pathologist to learn kidney biopsy interpretations as a prelude to a kidney transplant program in about 2 years. This training program has allowed HUM to become the first ACGME accredited hospital in a low-income country. Thanks for this award and the $1,000 to advance our projects.
Our second faculty recipient is Dr. Matthew Gartland, who is an instructor in medicine at Brigham and Women's Hospital. Dr. Gartland receives this award for his service at the MGH Asylum Clinic. Congratulations, Dr. Gartland.
We founded the MGH Asylum Clinic in 2017 to provide pro bono medical and psychological evaluations for asylum seekers from around the world who have suffered persecution. This is an effort of many amazing people with whom I share this award. I'll share a brief story about our recent work. During the COVID pandemic, we've shifted our evaluations to a virtual platform. Several colleagues and I have collaborated with a legal organization supporting families in ICE detention facilities near the US-Mexico border. While the core of our work is to document evidence relating to a person's legal claim for asylum, in this partnership, we have evaluated families' medical and psychological hardships in detention, as well as their risk of COVID infection. A series of legal declarations by our volunteers contributed to a recent court order to release all children from ICE detention. I want to thank the faculty champions, mentors, and colleagues in the Center for Global Health, the Department of Medicine, and the Division of Infectious Diseases at MGH, who helped bring this idea into fruition. I also want to thank the staff and volunteers for rising to meet every challenge, and our patients for demonstrating resilience and seeking a better life for their families.
Our third faculty recipient is Dr. Ariane Korouche, Assistant Professor of Dermatology at Massachusetts General Hospital. She receives this award for setting up the Project Phoenix. Dr. Korouche, congratulations.
Project Phoenix is a community service program that we founded here at Massachusetts General Hospital to help people have a chance at a new life by removing their tattoos. We have helped many people that have escaped lives in gangs, that have tried to turn their lives around by helping them to remove their tattoos so that they can be safe, acquire jobs, and reintegrate into safe and healthy circles in society. More recently, we have been privileged to be able to help human trafficking survivors, young women who have been able to escape these dangerous crime rings and were seeking to remove the crime-associated tattoos that were forcibly placed on them. I would like to thank our chairman, Dr. David Fisher, and the leadership of our department for really believing in me and founding this program, and for their perpetual support in the 5 years that we've been running. I'd also like to thank Dr. Rox Anderson, Dr. Bill Farinelli, and Ms. Beverly Damon from the Wellman Center for Photomedicine, who helped me to found the program by facilitating the donation of a laser from the Candela Corporation, and we thank them for their generous support in donating a laser. Also, I would like to thank my mentor, Dr. Ernesto Gonzalez, who has been a champion of all underserved people in dermatology and in medicine, and he has been a tremendous role model and advocate for me in doing community health work here at Mass General. I would also like to thank Ms. Luell Chapman from the Department of Dermatology, who has been a wonderful teammate and supporter of all the community health programs that we run in the department, and has been by my side putting in hours of time into all the programs that we run for the community. And I would also like to thank our wonderful dermatology residents who have been at my side, taking care of patients, really just inspiring me and everyone who works in our programs with their attitude of service and advocacy for our patients. So thank you so much for supporting us and helping to empower us to advocate for these patients.
And our fourth faculty recipient is Dr. Deidre Tobias, Assistant Professor of Medicine at Brigham and Women's Hospital. She receives this award for her work at Norwell Farms, Inc. Congratulations, Dr. Tobias.
Norwell Farms has been around since 2010. It started originally as a small organic CSA for the town to purchase and help grow vegetables on. But since then it's expanded in a direction towards community service and is a 501c3 nonprofit with the simple goal of really connecting the community to local agriculture, its benefits both to the land and to the earth, as well as to eating the healthy, fresh produce that comes out of it at the end of the day. And we reached this mission by having a number of educational programs for both adults and kids to come to our fields to learn about it. We come to them, to gardens, to schools, and to promote what it is that we love about connecting with soil and food and everything in between. Food pantry donations are really important to us. We have surpluses throughout the season and carve out extra space on our land just so that we can donate to local area food pantries and to low-income housing shelters and a number of other food insecure organizations around us. And that allows us to really kind of also fill that mission of filling the education and the connection for more than just our community, but beyond. I'd really like to thank the Dean's Committee for having this award available. It's really helpful to our organization, as well as all of the volunteers that sit on the board of Norwell Farms and really give their heart and soul and weekends to make this community farm and our mission work, as well as the farmers in the area that give us endless support and guidance to really make this work. And the community and for all their donations are also what really keep nonprofit organizations afloat. So we couldn't do without them, and we thank everyone.
So I want to thank everyone. Amazing work that all of you are doing. Makes me very proud to be a part of the Harvard Medical School community, where we have excellence in research and in teaching and in clinical care, but also in service in so many different ways to so many different communities. In these uncertain and trying times, community service is so very important. It provides a vehicle for our faculty, our trainees, our students, our staff to become more aware of the needs of others, but also to use their talents and skills, their energy to make a difference through giving. This service you've seen comes in many forms, and contributions don't always have to be heroic or financial in scope, but really responsive to the needs in a given place and a given point in time. And so with that, all of us can be engaged in service. It's about giving of our time, of our talents, of making a difference, of having an impact, of improving the world in which we live. So I thank you to all of the recipients. I thank you to the many colleagues and family members and friends who've joined us for today's calls. And I particularly thank the members of community organizations who have also joined us, who have given us an opportunity to work with you as you further your mission and your goals. So I thank you for being with us today. I'm just going to turn this over briefly to Dean Daly to say a few words as we're closing.
Thank you, Joan. I just want to say again, after hearing everyone's discussion of the important work they do, how proud I am on behalf of Harvard Medical School for all that you do for our community. At a time when we're facing major crises, whether it's healthcare or racism or the financial calamities that are affecting so many of us. It's important to remember that Harvard Medical School and its wonderful faculty and students and trainees and staff really are also passionately dedicated to the communities around us and around the world. And I can't thank you enough for all that you do. And now on to the photograph.